I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point are struggling and seek assistance. This month's episode is entitled The Impact of COVID-19 on Children's Mental Health. The month of May is Mental Health Awareness Month, and May the 6th is Children's Mental Health Awareness Day. As we approach the month of May, this show serves as a part of our initiative to raise awareness about the importance of mental health, with our discussion focusing on the youth in our community. Did you know that 1 in 5 people in Franklin and Grand Isle counties will experience a mental health challenge during their lifetime? With stress, anxiety, and depression becoming more predominant as a result of the COVID-19 pandemic, the effects have brought incredible disruption to everyday life. To discuss the impact of COVID-19 on children's mental health, I'm pleased to introduce this month's guest. And she is Danielle Lindley, the Director of Children, Youth, and Family Services at NCSS. Danielle, welcome to the program.
Thanks for having me, Joe.
Yeah, it's great to have you here, and I think what a timely subject with everything that's been going on. I mean, I know we provide the services all the time, but certainly what has occurred over the past year has been extraordinary.
Absolutely.
So with that being said, and with your division having such a vast array of programs that are offered, you know, what are some of the ways that you've been able to address the needs of youth?
Well, over the last year, we quickly had to adapt our services so that we could continue to meet the need of our community. So part of that was going remote and also being mindful of that a lot of what we have to do is also has to be in compliance with the governor's orders.
Yes.
So that has ebbed and flowed in our process. But what we've been able to do is really adapt our services and offer remote to families. Some of our school services are now located on site. We have begun to have a lot of virtual groups that actually has been extremely beneficial to parents because I think that's actually more accommodating to their schedule. So that's been a success. We've been offering trainings within the schools around mental health first aid. You Matter. We've started doing virtual mindfulness groups in some of the high schools, which has actually elicited more attendance from youth. So that's been extremely successful. So it's really an ebb and flow process and kind of meeting people where they're at and saying, how can we accommodate our services to support you? And so that depends on whether it's the school, a family, the age of the child. But I would say overall, it's been relatively successful in how we've been able to adapt to meet those needs.
Mm-hmm. And let me ask, during this time frame, have you seen an increase in referrals? And what about the level of acuity as well?
Yeah, we absolutely have seen an increase in referrals. We have a lot of children and family that before probably wouldn't have been on our radar, but because of the impact of COVID, have been referred to our agency. I think part of the concern is that we've had an increase in referrals, but we also have had a decrease in the level of engagement because of the impact of COVID-19 on people. You know, people are just exhausted. Mm-hmm. They feel like this is going to last forever, so it feels overwhelming. There's a lot of increased anxiety, depression, and so this has really impacted people's ability to engage in services. Typically, if through an outpatient lens, you'd work with a youth for an hour. Sometimes we're lucky to have a youth engage in a virtual telehealth session for 15 minutes. And so it's really had an impact on the quality of service that we're able to provide. As far as acuity, we've also seen a dramatic increase in the number of youth that are seeking and needing services out of our community. And that's for a variety of reasons. One is obviously the impact of COVID-19, but also that we are because of the safety precautions, we don't have necessarily the placements to put people. A lot of families rely on like mentoring programs or respite and natural supports where they can go to get those breaks. And because of the restrictions that we have right now, we just simply can't use those resources. And so it's resulting in a dramatic increase of families that are needing services outside of our community.
Yeah, that's difficult. I mean, that is one of the one-on-one scenarios that I know has really been impacted severely due to this pandemic.
It is. And, statewide, when you have already limited resources and where you can place the youth, they also have to be in compliance with safety precautions.
Sure.
And so the number of youth in which they can take is dramatically decreased as well. And so it's put a real strain on our system, unfortunately.
Yeah. You've mentioned virtual learning, but what has the impact of virtual learning been on behaviors? And I realize that, the timeframes are different than they would be if they were in person and everything. But overall, when you talk about behaviors, what's the impact look like?
Well, so it's interesting. I will start off by saying, so virtual learning has been successful for some youth. I mean, there were very some families were very intentional in saying, I want to take advantage of this opportunity versus trying the hybrid or engaging in class if they were able to 5 days a week. And so for youth that already had a lot of anxiety and didn't like to be around peers or felt too overwhelmed being in the classroom, this has been a success. On the flip side, and unfortunately, I think that's for most of our students and clients that we're working with, it's just has been overwhelming. And, we've seen a lot of clients who we've had to actually disenroll because they're just not engaging and they're not showing up for appointments at all or accessing virtual learning. There's tremendous numbers of students that are truant right now because they're not accessing. And it's interesting, I was in a conversation this morning because there's the population who are just feeling like overwhelmed, angry, I'm not doing this is pointless. And so those are kind of your truant kids. And then you have the population of they're just overwhelmed and feeling hopeless. And so it's more of, I just don't have the resources or supports to do this. And so I'm not going to engage. And those are two different populations of students. And those are two different ways to tackle that. And so I think, families are doing the best job that they can. But as you see, people are losing their jobs. Childcare becomes an issue. People just don't have the infrastructure or the resources to be able to engage in virtual learning in a way that it can be effective. And again, I want to point out that's not for all students because in some, we do have populations in our community in which this is working well. But I would say for the most part, hands down, most people want their children engaged in school 5 days a week, given the opportunity. I think it's also been really hard on adolescents. Adolescents at this time, they want to be around their peers. They need the structure. Most kids need structure. And we can all probably hands down say that this past year has been anything but structure and routine. And so I think just that in itself has had a real impact on people's ability to be independent and engage in virtual learning.
Yeah. And let's talk a little bit about the shifts that you've seen that are relative to the caregivers and their children as a result of the pandemic. I know you've mentioned about some of the things that are potential problems with virtual learning and things like that. However, when you think about the caregiver as well, and then that dynamic between them and their children, everybody under one roof instead of them going off for the day to school, and all these different dynamics. In general, what have you seen?
I think it's more of the same as just overwhelmed and exhausted and just tired. And so when you have these expectations of working remotely, helping your kids engage and learning remotely, and yet you're not sure if you're going to be able to make rent or pay your mortgage, or do you have the money to get groceries this month? It's just, how do you prioritize those things? And so, essentially we want to look at having our basic needs met, and that becomes the priority. So when you look at self-care and you look at connectedness and all of these other things that we sometimes take for granted, those things get put to the wayside and they're not prioritized. And so I definitely think that caregivers are completely exhausted. And, something that we try to just embrace is that, sometimes you might take it one day at a time. Sometimes you might take it one moment by moment and just give yourself some grace and remember that this is a pandemic. I don't think anyone can prepare themselves for the amount of exhaustion and stress and, toxicity that you're going to experience as going through this process. But I think caregivers are really, because kids can't go out and hang out with other kids, or they, may not have the employment opportunities or groups and sports and ways that they used to be able to engage. It's just overwhelming, and people are looking for breaks, and it's just not right now the time to be able to do that for numerous reasons. So
yeah, and you talk about the socialization aspect for youth. I mean, it's huge, and they've always been taught about playing nicely with others, sharing, all this sort of thing, which really has been shoved to the wayside for the past year because it had to be.
Yeah, I think it's going to be really interesting as a society, kind of how do we become social again? I mean, I think most people that I run into now that I'm, able to go back into the office a little bit, we kind of all just start with like, this is so awkward. And so like, even as adults, how are we going to begin to socialize? And so I think that's going to be really difficult for youth and for children. And then also now that they haven't had the opportunities to physically, connect, what's the impact of social media? And, we're already worried about that pre-COVID. And now social media has become such a mechanism for people to connect that I'm curious to see the impact and the, how that plays out in the next coming months, because I think people are going to be even more fearful of, having tough conversations or communicating in a way that is effective, and they're going to become more reliant on the non-face-to-face communication. So I'm just curious how that's going to play out, and I'm hoping that it won't have as much of an impact, but I do think that there's going to be continued increased rates of anxiety and depression for not just youth, but for everyone because of the impact of COVID-19.
Yeah, and when you think about it from the lens that you sit in, is you could be talking years of trying to get individuals that you're working with to be able to overcome just what they've been through, say, over the last 12 or 13 months.
Yeah, I think that, the interesting part is that there are so many people being impacted by this, but yet like our budgets aren't getting bigger. Like we're not getting an influx of resources to serve people. And so we're really having to be intentional on how we're providing clinical services and triaging, which doesn't always feel great because I think a lot of people could impact from a lot of service right now. And we just don't have the resources to be able to do that. And so I'm hoping that, we're going to have to be innovative and more creative in ways that we're working together. We're going to have to become even more reliant on community partnerships and collaboration. And, part of this process, because of safety precautions, but also needing to be very mindful of our resources, is that before we might have had a family where there were 4 or 5 service providers that were working with them, and we really have had to say, what is the most immediate need and who needs to be in the home or in the community with the family? Because we have 10 additional referrals that we need these other folks to go meet with. And so we've had to be very creative in that and also reliant on our community partners for referrals. It's been interesting to look at kind of the age spectrum. From like a younger child perspective, we would get a lot of referrals from WIC or Department of Health. And a lot of those folks have been reallocated to be first responders in their efforts around COVID-19. And so we're not getting as many referrals as we would have in the past from those areas. But yet schools are completely overwhelmed because they don't have a pulse on many of the kids. And so they're sending referrals. And yet we're not able to engage because the family is disconnected and just overwhelmed. And so the positive is that our agency of education, each supervisory union has to develop what are called recovery teams. And so that's bringing a lot of the community partners together to really say, like, we know the next year, while the pandemic, in some ways, COVID-19 rates might be decreasing, or we're hoping that they're decreasing, we can start to reopen. The impacts of this is going to take quite quite some time. And so looking to build really intentional teams of let's look at the gaps right now. Let's look at how we can start identifying school attendance or addressing school attendance, social, emotional, and mental health needs of students. And so those teams are currently in the process of forming and developing action plans. And I think those have to be developed and kind of solidified by the end of the school year. And so I'm curious to see what that looks like. And I'm very hopeful actually that those teams will be able to develop some very creative ways to start meeting the needs of our youth.
Mm-hmm. Let's take a moment to talk about the gaps, from a system standpoint and the impact that they've had on youth and families during this time. You had just mentioned about the fact that because a lot of people that we would work with who are community partners, their roles have changed because they needed to during this time. That probably in a certain way has provided other gaps that maybe weren't there before. But anyway, I think it's always important for people to hear that in the system of care, there are gaps. And, in today's world, how are they impacting the youth and families?
Yeah, I mean, I think right now we're at a place where while we are essential workers, we still have to really use and prioritize safety. And so part of that is the clinical triaging. So in some ways, like I said before, I'm nervous that people aren't getting the high level of quality that we would want them to, because we're really at a quantity part right now of we need hands-on or we need eyes on. We need to be able to go in the home and just make sure that safety is being addressed. There's also, like I said before, around mentors and respite providers and placements. That's a huge gap right now. We're really working with our state partners and developing some opportunities potentially down the road to bring some of those like crisis stabilization beds to our community, working on expanding the criteria and eligibility for youth so that they can access respite providers, and in the same respect, looking at increasing payment for those providers because that is sometimes a barrier. So we still have, there's a lot of gaps right now, and I think as our community starts to open up and these teams are formed, we'll have a better picture of what do we really need to target right now so that we can have a greater impact on kids.
Yeah. And let's talk a little bit about the NCSS SOAR Learning Center and how have they been able to manage during these unprecedented times?
I just have to say I'm incredibly, incredibly proud of that team and just in amazement of what they've been able to do. When the school shut down within 2 weeks, they were able to get technology to all the students, go completely virtual with their education. They were doing meal delivery, and they were able to really do it successfully. And so throughout that time period, they were able to also provide graduation, actually in person in the parking lot to the high school students. And then they did a virtual graduation for the 8th graders. And so I think right now they're currently serving about 70 students, which was really impressive. They were able to implement a 4-week summer program that was very successful. Currently, SOAR students are actually there 5 days a week. They've created staggered times for the elementary school and the high school so that they're not coming at the same time, and they're also using separate entrances. They do have remote learning options for students if that's going to meet their need. I think the biggest barrier to the SOAR programming being successful, and I'm so grateful that everyone kind of just jumped in, was transportation. We didn't even think about the implications of transportation. We have I don't know how many vans they have there, but probably like 50 vans where they can go out and just pick up youth, and you're able to pick up 4 or 5 youth at a time. Well, when COVID happened, you weren't allowed to have that many individuals in a van. And so this really meant SOAR staff who were not, van drivers going out and picking up students and making sure that they got to school successfully and they got home after school successfully. And so that was a lot of dedication on their behalf. And because of that, we were able to continue to provide services 5 days a week.
Yeah, that is actually incredible when you think about it, because, the success of that entire program is really that it's a total turnkey operation from the moment the student gets picked up in the morning to the time that they're let back home, in the late afternoon. And You're right. That is an incredible job that they've been doing under these circumstances.
Yeah, absolutely. And I should say that I believe they've had extremely low COVID rates. And so while doing all of this, have been able to prioritize safety, which is, I just think, really tremendous to watch and to be a part of.
And you bring up safety, and safety is, well, people wouldn't know this who don't work for NCSS, but certainly the number one value that the organization strives to achieve. And certainly that's really been put to the test these past 12 months with everything that everybody's had to endure. And the organization's done a terrific job with it. But I think it's a good point you talk about, is that everything is done through the lens of safety for the staff and for those that we serve.
Yes, absolutely.
So I understand that on May the 6th, there's going to be a screening of the documentary film Angst, which is targeted to high school age students. But can you tell me how this will be accessible not only to students and the staff in schools, but to others in the community? And maybe a little bit about the importance of this documentary.
Well, so this came out of the Children's Directors Group statewide. And we really just wanted to be very intentional this year in addressing and looking at children's mental health. And as we've talked about earlier, Joe, with, the impact of the pandemic, it's developed and increased our rates of anxiety and, children, youth, adults, everyone. And so this was a great opportunity. And we're going to actually do a film. I don't remember how many films in the series. I think it's 3 or 4. And so this is the first of that series. And so we'll kick it off the first week of May to highlight, like you said, Children's Mental Health Awareness Month or Week. And so what we're going to do is each kind of area or region has 200 licenses. And so we'll be starting to send out flyers to schools and to our community partnerships and stakeholders to say, if you're interested in this, you can either contact myself or Joe, and we'll be able to coordinate and get a link. And I think the cool thing is that it's a link for Zoom. So you can either do this with your family. It could be that there's a teacher in the school that says, I have 5 students that I think would really benefit from this. So we're going to block out a time and sit down and watch this together. You could host it at a community meeting where you want to use that as a level of professional development. So there's lots of flexibility. I think that's one advantage, of the pandemic, is that we really have embraced kind of Zoom and telehealth and virtual meetings. And so this will be held virtually. If you would like someone from NCSS to participate with you, you can, as kind of someone to facilitate it, or if there's follow-up questions. But the beauty of this is that you really can use it in any way that you find to be beneficial, and you can just contact myself or Joe, and we'll help coordinate that.
I believe what a great time to really feature this documentary and get people engaged in some conversation around the importance of mental health. And the other aspect is, I would hope, because I know mental health has gotten so much more press over the last year than probably in any 12-month period, because I think what's happening is more and more people who never felt they were affected by it before are beginning, because of the stressors, to feel, I'm just not feeling right, there's something that's off, etc. But again, the importance of mental health and its alignment with our physical health, and the fact that you really can't separate the two, even though for hundreds of years we have, and somehow the whole mental health thing is over here,
Right.
and everything else physically takes place, in a different arena. It really is aligned closely as to the holistic nature of an individual, its well-being.
I do think, an interesting upside to the pandemic is that I think in some ways, because everyone's mental health is being challenged right now, is that in some ways, I do believe it's helped reduce stigma around mental health, and it's helped people understand the impact and the link to physical health. And so it's, like I said, it just reduced stigma. And so people are way more willing to have conversations around it and prioritize it. When I think about the money that's coming down from the Agency of Education, it's targeted at mental health. And I don't know, maybe that would have happened prior to this, but because all of the research and the data is showing like what the waves of this pandemic will do and the significance to mental health, I think that it's going to become even more of a priority, and people will begin to embrace that even more, of how we need to really put a lot of emphasis on addressing that.
Yeah, and it's getting people to talk about it because, as you know, for so many years, the minute a conversation would turn to mental health, people would dive under tables. It doesn't happen here, et cetera, which of course isn't true. But I think getting people to just sit like we are and talk about mental health concerns, just like they would if they were a diabetic or had a knee problem, or you know what I mean. They would do that and talk about that probably relatively freely.
Right.
But to get people to talk about their mental health and how they're feeling and maybe what they could do to change the way that they're feeling. You know, we've talked a lot today about Zoom as a platform or video conferencing and embracing it. You know, anytime there's any circumstance like this, which has really been very difficult, this pandemic, but there are always ways that you come out of these circumstances and you have some new ways of doing business or providing services. And certainly you had mentioned earlier, but when you look at video conferencing as an example, as a method with telehealth or what have you, certain individuals will embrace that better than the one-on-one in person.
Mm-hmm.
And likewise, there's people who need to be in person. So really what it does is it provides the clinicians with another tool in their toolbox to be able to reach someone. And, you know, I really think that over the long haul, and I know there's Zoom fatigue right now. I know a lot of people, it's like, please, I don't need another hour or 4 hours on Zoom today.
Right.
But there will come a time that it'll be used very strategically. And would you feel that, you know, for the population that we serve in the rural nature of our area, that technology, of course, the ability to have that technology in the home, but will be another great part of the platform and services that are being provided?
Yeah, absolutely. I was just going to reframe a little bit of what you said, Joe, and it's a tool for clinicians, but it's also a tool for parents. I think in the past as clinicians, we would say, nope, you need to be in the office. And it's just so hard for parents that are trying to balance, you know, maintaining employment and childcare and extra school, you know, after school activities and all of these other things going on in life. And we'd say, nope, but I need you here. And so one is that as a designated mental health system, we have really been advocating at a state level to continue this. And I think, you know, funders such as Medicaid, private insurance companies, I think are hearing that and are going to continue to fund that. You know, telehealth has always been an option. And it's just been how people embraced it has varied across the nation and globally. And so I do think telehealth will stay. The cool thing about telehealth is that, you know, there have been certain populations this has worked wonderfully for. I wouldn't have thought about it, but within the schools, when the schools went remote, you know, a lot of times the communication with parents was not, it wasn't very elaborate because, you know, the child's in school. So a lot of the treatment was happening between the school providers and NCSS staff and the client. Well, because the children were at school, like parents wanted to be more involved because they needed the help. And so our school-based services really increase their level of parent engagement through this. And also with a lot of our kiddos that have been diagnosed with autism, this was really a great mechanism and a way to bring in families so that they could do the parent education and parent support. And you got to kind of see the learning happening. And so our providers were able to provide feedback right there via Zoom and say yes, or reinforce, or give other strategies and give feedback. And so hands down from our teams, we've heard that we don't want this to go away. We want to keep it as an opportunity, or as you said, as a tool to be able to work with families. And I don't see that going away.
Well, what a great way to end today. So, you know, because it really is all about not just the children, but the parents as well. So I'd like to thank my guest, Danielle Lindley, for being on the show today and sharing her insights on the impact of the pandemic on children's mental health. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS programs and services by visiting ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.